We're recording
So-
now.
Why don't you pull this chair around here, Pat?
Oh, yeah.
You look, sit this chair right here.
This is just real informal. Okay, there is nothing formal about
Is
this.
the sound on?
Yeah.
Sound.
Sound.
It's already.
I'm totally, see when it's blinking, I'm totally automatic,
Oh,
okay?
okay. That's the only way to try.
Focus and,
It's on now.
And you want to introduce Dad where he's from
No.
and everything, or?
See, Ronnie, had I known I'd been on TV, I would have worn my hair.
Yeah,
Gosh.
you're too
have
paid.
some more time, okay?
Uh,
The one thing that I have to, explain to you, so you really understand, that I'm doing a dissertation on interviewing, people that are 85 years and older that are still active, that are not in a nursing home, they're not developing, like yourself.
Should I give you some background?
Yeah.
Yeah,
Speak
okay.
loud though.
Oh, all right, I'm 87. Been in the medical field since 33. I've been very active even when I partially retired in 88. And then I went into part-time nursing home care. I'm now involved in nursing home care, taking care of the help at the nursing home, the help and the nurses and technicians.
How many nursing homes?
Well, this one nursing home has 300 beds. I take care of the help. 2 afternoons a week, and then I'm also medical director of the plasma center. Trained personnel, check the records. So I'd say I do about 3/4 of the average work week.
Mm.
And of course, I still get a lot of phone calls from the old patients. I mean, I'm from the old school. They're so used to getting prescriptions from me, they call me day and night, and doc, will you do me a favor? And I write a prescription. But the problem is, you have to keep good records on it and know who you're dealing with and not dealing with some addict, someone who wants some nerve pills and sedation. There's your problem. But it's, once you have a large practice, it's hard to suddenly decrease. People depend upon you for years and years, and there's no way of stopping it, you see. And people still ask me, I wish you were still full practice, because they don't get the availability with the younger doctors. They don't have the time, they overcharge, and they're hard to adapt to. They won't, they're hard to talk to. They're really spoiled compared to the old school.
But you had the biggest practice in town.
Yes,
For-
an annual 100,000 I did.
For how many years was it the biggest practice?
Well, I went there after the war in 48, and I think from about 51, 52, I had just 4 girls and just loaded day and night. Never home. Kids would criticize me because they wanted the father was a rancher, take them hunting and fishing.
Yeah.
So it's a big problem. The family suffers, but they get everything they want. They have good education, and they have a good lifestyle. I mean, anything. After all, the kids went any place they want. Did you, Ronnie?
Sure.
Anywhere you wanted to go, you were told to go.
Yeah, but you were dedicated
I
to
had
that.
no choice.
You
You
had
had your own choice of your,
I know.
future.
Uh-huh. But mother, was she a problem as far as entertainment? She always wanted to go somewhere or do things,
Well-
go out to eat. Now, I always went out to eat with her, and you were on house calls, sir.
Always gone, yeah. She'd go with me in house calls, but that got pretty stale after a while. Then she had to get involved with genealogy because she had to have a life because I was gone all the time. Saturday, Sunday, it doesn't matter. Every day's the same. When you're an independent, you're in real trouble. Nowadays,
In a
it's a
clinic.
different story. They have backup calls.
And you get answering services nowadays.
Yes.
You don't get personalized
And
service.
you can't get a doctor the weekend. The wife takes the calls, or he's not out of town.
Mhm.
It's almost like a lawyer. She takes the calls and not available.
Mhm.
I read some of your thesis evaluation. Uh, the adaptability is number one. Another problem is over the years, if you've been in a depression, you worry about the financial future and you worry about your condition. So you overwork because you worry about the future.
Mm-hmm.
And that was a real problem. But it's good to go through depression because you realize what people go through. You give them prescriptions, you give them drugs, samples, and you undercharge.
Mm-hmm.
That's been a big problem. I had more people on my books probably than anybody in town. Hundreds of thousands over the years, non-payable, and never could collect.
And how many house calls a day did you make on an average day?
Oh, 2 or 3, but I would run anywhere from 10, 15 patients in the hospital a day. And that means early morning and night.
And a house
When you
call,
make two calls a day in the hospital.
morning and afternoon.
However, it's a small town, 100,000, you get any place you want in 10 minutes. So you couldn't do that in the city. There's no way.
And how much did you charge for a house call?
Oh, way back in those days, $10. It was after the war, $5 office call. It was
And people didn't have insurance, did they?
no insurance, and
They paid cash? That's
they,
it?
they pay cash, or you charge it.
Yeah, but wait a minute, Ron.
Everybody, if you're a Texan, believes you should be able to charge it. You can't criticize their credit.
Hmm.
That's number one.
Mhm.
The problem of charity cases, we went to charity clinic one afternoon a week for 3 months a year. So every Thursday afternoon, I went to charity clinic, saw all the charity cases. The only people paid was the nurse, the pharmacist, the secretary, but not the doctor. We were required and told what we had to do. So we took care of the charity, and there was no trouble about Medicare or Medicaid. They were treated well. In other words, that's a better program than keeping in your office to have everything in one place. So they were really covered compared to what they are now.
But let me ask Dr. Landy something. How long have you been in practice?
Well, I graduated in 33, a long time ago.
World War II.
And then 1 year internship, St. Louis City Hospital. 2 year residency in chest diseases, St. Louis Cook Hospital. U.S. Army Medical Corps. That was in Hot Springs, Arkansas. But things were so bad, nobody'd go to practice. St. Louis was, the doctors were charging only 50 cents a dollar office calls. So I went in the service. I didn't care for the social life, and I quit it after 1 year, but I had to keep my commission. Then I went in the VA for 5 years, Asheville, North Carolina, Saranac Lake, New York, Pittsburgh, Pennsylvania. And then I went in the U.S. Army Major Medical Corps, large hospitals here and overseas. And then I had a 2 year residency, University of Southern California, Los Angeles, and I went to practice in 48 in San Angelo. So I've been in the hospital about 14 years before I went to practice, chiefly down economy.
Mhm.
But you're well trained when you first go into practice. Over the years, you can't keep up the availability of the literature. You're
Equipment.
too busy making a living and practice. So I thought that was high powered when I left the residency, and I'm in the same boat as the older men were when I went in. I thought they were way behind,
Mhm.
but there's no way you can keep up unless you're in medical school and teaching. There's too much going on. The involvement and the
New procedures.
scientific changes are so great, it's impossible. That is why you need more residencies, 3 to 5 years. You can't do it with an internship.
But out of all those years, how many days of work do you think you missed?
That's a good
I
question.
had a disc surgery in 1980 and missed 2 weeks. I had a high temperature, 102, and I was out for 2 days, and that's all. I couldn't go on vacations because I had to go to medical meetings. 4 girls drawing salary, and they wouldn't go take their vacations. They wouldn't go with their husband. So your overhead gets very high. My only vacation was going to medical meetings. I don't know, Switzerland, remember, in London, and Nassau, things like that. But
You didn't miss much work.
Twice?
Talk about purpose. I mean, my purpose is to keep as active as much as I can. Otherwise, I'm going to go on the wayside. I mean, I'm going to fall behind. I mean, getting up every day, going to work. Otherwise, I get dormant.
Just watch TV.
What do you mean by fall by the wayside?
Lackadaisical, and you don't read, you don't have contact with your colleagues
No goals.
and know what's going on. Even though you're not in active practice in the hospital, you still have your medical meetings, you still have contact with the doctors at lunch
So you
and
still go
breakfast.
to
I
like
go to every day
Mhm.
to the hospital.
Eats breakfast with the doctors.
like rounds?
Well,
You
you see, well, we have lectures and men come in. It's a small town, so we have to have visiting physicians
Oh, I see.
that
I
come in.
realize it.
You can't, but we have a lot of tapes and we have updates in medicine. But you see, doctors have their own places to eat. Years ago, we used to go with regular dining room with patients, listening to the talk of the doctors, and that was real bad because it's confidential. So most hospitals now have doctors' dining room or an isolated area. It's not secret, but it should be known publicly about their thoughts. You see?
But you still go to these every week?
I go to all the meetings. I have tapes. The hospital has tapes. They have satellite. They have a good network of satellite medical talks.
And that's how you get some of your continuing ed.
Yes, and we have, the hospital brings in top speakers. We have top national known speakers that come in, and
But it's a big hospital. Tell her how big the hospital is then.
the hospital's 300 beds. It's a foundation. They have a lot of money. Money's no object. Take care of all the charity in town.
This is the St. Angelo.
Shannon.
Right.
San
And
Angelo Memorial Hospital. And the land was donated
Is that like a,
by the Shannons,
The state. It's
and
an
they
oil
had
state.
many producing oil. They had a lot of land, no heirs, and all was left to Shannon for the charity of San Angelo.
They'll never run out of money. It's just so huge.
No, it's the largest money loaning agency in San Angelo.
Hmm.
So it's quite a benefit, yeah.
do you still, I need to back up a little bit. Do you still have brothers or sisters, or
What's that?
do you have brothers or sisters?
I have one sister, she's older than I am, very active. So we've got a good family history. However,
How old's the sister? Is that who you
my
all,
sister's a
Cleveland.
year and a half older than I am. I mean,
In
so,
Cleveland.
that's who y'all visited?
yeah.
What's she doing?
She's a housewife. She
Good.
runs her own home. She has a large house rented out second and third floor.
She's a poet.
Sure.
Short, real short.
She's short, yeah.
And
She
she
has-
writes poetry.
Writes a lot of poetry, yeah, but she tries to stay active, and she's doing all right. And my mother died when she was 86. My father died at a young age he had sarcoma femur, secondary to an injury. So I can't tell about my age expectancy, because his was mostly fracture of a leg and he had sarcoma when
Because
I
of the
was age
fracture.
70. They don't know.
They don't know. He was 70?
No, I was age 7.
Oh, 7, okay.
Yeah. So I don't know about his background. It's important.
What about your grandfather though? What about his
See,
father?
I can't tell. My mother came over from Poland when she's a young girl. And my father's one of about 7 brothers, and I can't find about the background. Usually when they came into Ellis Island, they couldn't understand the language. They think the name was Landsman, and they made it Landy. So we can't, there's no genealogy background that I can find in regard to my family history.
That's interesting.
You see?
It was Landsman then.
They think it was changed.
Mhm.
And a language barrier, you see?
And your father's father came from where?
Yes, but from Poland, but they married when they're pretty young. I can't tell anything much about. There were 7 brothers.
And you don't know
I
where?
don't know about their background. They all left Poland on account of religious
Persecution.
persecution. Yeah.
But you have a sister still active, year and a half older than you.
Yes.
And a younger brother.
Well, he's a
Half-brother.
half brother, so
Half-brother.
I can't tell him that.
Mhm.
You see, my mother remarried when I was 7. So, but
Any other relatives that I thought Elvis did,
We went to a family reunion years ago, but they're just real distant cousins. The Landy, or
they're all cousins.
yeah.
So can't get any background. We tried it. There's no way. You see. But really, the purpose in continuing work really is not the financial. It's to be active and be involved with the family.
And the
And
challenge.
keep up with, try to be, trouble is you can't do what you always want to do.
Mhm.
I used to go to the spa 2 or 3 times a week,
you do?
yes. But
Oh, I know that.
the thing is, after a while, the pool gets dirty, the hot tub gets dirty, you give that up. But I still get a massage once a week, but it's hard to get activity
Mhm.
because I have a disc. I've had a disc with surgery. My left leg is weak. I can't do the walking like I used to. But physically, I'd like to do much more, but I can't on account of my legs. But the activity really helps, just going every day, getting up, not being at home.
Mm.
And
But you're still driving.
what's that?
You're driving.
Oh, sure, yeah. Physically, I'm in good health. I know there's no problem. In fact, my health is too good. Listen, my life insurance, I'm paying too much now.
Yeah.
My life expectancy, I thought, so I would have been better off not having any life insurance and paying all the premiums. Now I'm paying too much for it,
Mhm.
you see?
And then your Social Security, you were lucky you started that when you were 72.
Yeah, I took my Social Security when I was 72. Now you can take it at 70 and make all the money you want. You don't have to declare it 2 for 1.
Mhm.
But you have to be real lucky if you take it at that age. But it gives you good benefits if you do, if you're lucky enough. I know a lot of people never got a penny. 65, 67, they keep working, they die.
Mhm.
Never get a penny from Social Security. But they say take it at the youngest age, 62. And if you take it at 75, 72, but it's been decreased to 70 now.
Mhm.
So A lot of people won't do that. I mean, I just have to be very lucky, I'll tell you.
Is the most satisfying thing that you do now really patient care?
Yes, nursing home, you get a lot of phone calls, it's a lot of involvement because people are hard to take care of nursing home when it comes to family. Your involvement is too great. You get phone calls all the time. They only allow you one call a month on Medicaid, but you get a lot of phone calls. They won't pay for second or third calls. It's not a good practice because the legal aspects are very great. You're too many phone calls and you depend too much on the nurses to give you a proper evaluation of the patient. And if you're unsure and there's problems, you send them into the hospital. You see, which you have to do many times. But a lot of people have the living will now, which helps a lot, where you don't get heroic and don't
Ventilators.
excessive use of medicine and just normal treatment and treating the symptoms, but nothing heroic, IVs or resuscitation and the like.
Is there anything else you'd rather be doing
No, I don't think there's anything. I don't think I would have changed anyway. I think the best thing is going into a small town. You don't have to fight traffic. You don't fight the drugs. The smaller town is much better. It's easier to get around. You make house calls and hospital calls. I was brought up in Pittsburgh and Cleveland. Doctors were never home, making calls to 2 to 3 hospitals once or twice a day, and it wears them out. And I think that's one of the big problems. It's an easier type of practice in a smaller town.
Tell Pat you left that part when you went to school. What happened when you left Pittsburgh? You went to the University of Pittsburgh, but it was difficult to get into medical school in the States, and where you went.
Medical school, they had a quota on religion and blacks. The trouble is, too many people go into pre-med. We had a class of 400 pre-med at the University of Pittsburgh, and they took 65 people. Well, they shouldn't admit to pre-med to go through 4 years and not get medical school. They should select the people and cut down the quota to be admitted. There's another University, St. Louis Catholic school. They admitted 200 freshman medical students. They were told 100 would go into the sophomore year. Well, that's a bad way to do to know, and once you fail out medical school, you're finished. You can't get anyplace else. That's on your record. But people take the chance just to get into medical school. And it's getting, it used to be better, your admission rate, the quota has gone up a little, and the selection isn't as difficult. However, you have to take 50% of women now. And there's a big problem because you've got half or 3/4 of women who go through medical school and won't practice. They get married, have children. In fact, we have many people in our town that time has been wasted.
That slot is wasted.
That somebody could have had that place. But they're entitled, under law, 50%. That's what it should be. I don't know how they could work that out.
So when you
that diminishes the admission rate of males.
So when you couldn't get in because of religious quota, mainly, what did you do then? How did you get into medical school?
I went to Vienna, which at that time was one of the top-notch places in the country, 2,000-bed charity clinic. The language was so difficult. I had 2 years of scientific German, but that wasn't enough for medical school. I went to Edinburgh, was admitted, and I stayed there for 4 years. And most of those charity cases, and you do a lot of work, which you would not get in the United States, they're medical teaching was very high, but that's degraded now on account of the charity services they've been giving and the financial. America bypassed
But
it.
Edinburgh was rated one of the top in the
high.
world, wasn't it?
And Vienna at that time. Don't forget
Wait a
that's
minute.
29.
But when you said religious quota, are you talking about being Jewish?
Yes,
Is that there,
yes,
there
that's-
was that much discrimination?
No, not
Okay.
discrimination, but it only allows six to seven. It was population. The percentage of population growth at that time was about 6-7%. But the problem was maybe a third or half the class was Jewish. So there's where your problem is. They can't admit all of them. They
Right.
should not admit to pre-med.
Too many
See?
pre-med.
You know.
That's discrimination.
Well, yeah, that's discrimination, but it's better now. They still may have quotas, but they're going more on your test scores now.
Switch.
And it's a little easier to get in because medical school is so expensive, people don't have the money. They've had to lower the standards in order to get the people to go in, because it takes a pretty wealthy person to go to medical school. 4 years, internship a year, and maybe 3-year residency for specialty. But specialty services are gradually being faded out. They want more family practitioners, up to 50-60%. Under the new laws, the family practitioner will have to refer to the specialist. So they're cutting out more specialty training and more family practice. That's the way your medicine's gonna go for years to come.
If you had it to do over again, would you still be a family practitioner or would you be?
No, I was an
specialist?
internist.
Internist.
Yeah, I did do the children, pediatrics, and then OBGYN. Referred a lot, mostly heart, lungs, and chest.
You
I
referred a
probably
lot,
did more referral than anybody in town.
but you referred a lot to the surgeons, heart surgeons in Houston, DeBakey.
At
and
that time, Cleveland Clinic was #1 in the country. And then Houston came up, surpassed it. Now, San Antonio was taken almost away from Houston, or just as much. Lubbock has it. We have a cardiac surgical unit, costs $1 million. We have 2 cardiac surgeons in town. They do about 300 a year. That's a town of 100,000. And that's a lot of surgery, doing about 300 a year with a very low mortality. So they're top notch.
But the cases in the old days before they did surgery in San Angelo, you sent to DeBakey
Houston.
and Cooley. Were you ever
DeBakey.
wrong on a diagnosis? Did they ever?
Well, of course, you wouldn't have the diagnosis. We didn't have the sophistication arteriogram. They made the diagnosis. We'd set them down. We knew they needed something more than we could give them medically. So, and I sent them out to DeBakey and Cooley, and they were very considerate. They always follow up on their patients. They're very good.
Did they send you a Christmas card?
Oh, sure, yeah. And then in a town like
They should.
San Angelo, we'd have a neurosurgeon coming from San Antonio. And things, until more people came into San Angelo, well, we didn't have the specialists. Now we have board certified, a town of 100,000, we have maybe 170 doctors. And the board men, we probably have over 100 board certified. So we've got too many specialists. You need more family practitioners. You see?
But even though you were an internist, your practice really sort of took the route of family practitioner, even though you didn't see children.
I wouldn't see children, yeah, but you refer a lot. I mean, that's the important thing. You make a diagnosis, and you refer properly. You see, that's what should be done. Nowadays, people just run to any specialist they think, and it may not be so. That's where your cost of medicine is going so high. People won't go to an internist specialist. they have something wrong, or they'll use their own judgment. According to the new Social Security program, you'll have to go to family practitioner, then referred to specialist. So the whole scope of medicine will be changed, the way it's going. Maybe that's the correct way because the cost will be minimized. You see?
But are you still having to take care of your kids?
Financially. I think that's another purpose of working is just be sure they're well satisfied and controlled and give them everything you can. And,
So that's where you get that from.
Yeah,
you know,
the control.
so it's been satisfactory. I don't think I'd change it all. I picked the right small town. I never wanted to go back to a big city. I'd grown up in a big city and I knew what would happen. And I wanted a town, not a little small country town where you couldn't practice proper medicine. But San Angelo had good hospitalization and they had a good medical center that's gone much higher.
Well, how did you pick San Angelo? You were in Los Angeles practicing in the VA hospital in Van Nuys?
Well, that was for residency. I picked San Angelo because I wanted a small town. I could have gone to Lubbock, Amarillo, Albuquerque, San Angelo.
But you saw an ad in the paper, or what was the story on that?
Well, I knew a doctor in San Angelo, but he expired before I got there. But I thought it was a good place to go to.
So you took his practice over. What was left of it?
Well, he expired. They never told me a year before. I took over practice, which was nothing left. But
So you started in there.
started raw, yeah, which is hard to do. And it's very difficult to start in practice as an independent. No one will go into practice independent now. There's no way you can do to handle Medicare, Medicaid, and the billing and the numbers involved. You have to have an office force. See,
Expense
yeah.
of being clinic.
Do you feel like you've been able to keep up with the computerization, the technology?
Well, I have a computer, but the girl hasn't worked on it yet. All your billing now will have to be on computer. In another year or two, Blue Cross Blue Shield won't take any mail or letter form. Otherwise, they're going to charge you more for that. So you're going to have billing on computer.
And he did mention he has a secretary
Who would have ever
who
thought?
handles everything, and Dad just bought a computer a couple of months ago, so they are computerized now.
Yeah, so she's going to work on it. She's going to do that. Of course, I'm a small operation now, but even so, they're going to require it. You see?
I didn't know.
And they're not going to take regular billing. It's going to cost you more to get your work done compared to what
It's
they.
the electronic bill.
So they're telling you what to do. That's what's going to be in most businesses in the
Managed
future. Everything's HMO. Doctors will be just servants to HMOs and be told how many patients a day to see, how many hours. I was in England during the war. Practitioner there would have 2,000 patients on a panel, works 8 to 5, and that's it. So there's no incentive to work. You got a salary, you see.
Mm-hmm.
You want a procedure, pelvic or rectal, Thursday morning.
Mm.
And they lose track of their patients. Once they go in the hospital and they wait on the waiting list, you lost track. That's the way medicine's going to be in the future.
But how many hours would you say, on average, would you put in?
Oh, 60 to 70 hours anyhow. Saturday and Sunday. I mean, you're going to make rounds. If you're an independent, every day's the same, Saturday and Sunday.
Twice a day.
You've got to make your rounds and they take all your phone calls. You see?
When you say round, you mean at the hospital?
Hospital, house calls, and office. And sometimes they have a full office. You get finished at 6 o'clock and we have to run into the hospital. You may not get home till 7:30. I was never, how many times have you seen me at night to eat?
Supper maybe once every 2 weeks.
So, it was very, very, very difficult.
And usually there was a house call after you came in, you had to
Yeah.
leave. Plus during the night, the phone rang all night
Yeah,
long.
but you see, once you're a doctor, you're involved. You work or you don't work. There's no halfway going if you're an independent. You see? You understand?
Yeah, I've just never heard it.
My brother
That
from
way.
Pittsburgh came, stayed for 2 weeks, and he said, I'll never forget that phone rang every night you went out. And then you go out at night, you got all day. So when you do have some time, you try to get some sleep.
Mhm.
You're up half the night. And you've got to build up a practice in the beginning. You take all kinds of calls. So you get to be known as a charity doctor the first 2-3 years, and you go broke. Everything's on the book, you don't get any money coming in. So it's very difficult. The doctors nowadays, altogether different. They go on a salary, they got a clinic, they buy into the clinic, and it's altogether different, you see.
So you really didn't have any time to yourself at all?
No.
No hobbies?
No hobbies, none whatsoever. But it's good to be active. When I went to Pitt, I used to pitch softball. And I played semi-pro softball. Get $5 a game. And once you're in athletics, I mean, that's what keeps you going. So I kept basketball, baseball, and that's one reason you get to be active. You can stay in sports. That's what really started me on activity, playing ball.
You said you weren't walking much anymore because of your legs, but you're not swimming anymore?
Well, the pool is very cold. And as you get older, you get cold-natured. You can't stand the cold. People that are cold want warmth. If you notice in a nursing home or anything, it has to do with circulation. And anyhow, swimming is one of the best, or whirlpool, but it's and then you don't want to overdo it because you worry about your cardiac status. You know, there's only so much you can do as you get older. You can't overdo it. See what I mean? It's just like not playing tennis for years. You suddenly go out and play a set, which you should do. You can overload your cardiac situation, not knowing how much you can take. That's what happens a lot. A lot of people jogging, they get older, they do too much, heart attacks. I've known a lot of people that overdo it, thinking that's the way to go.
Good thing to do.
You can't always do it. So you may want to do a lot, but you just can't do it. I mean, you're going to harm yourself.
So
You see.
how did you decide how much you could do?
Well, that's hard to evaluate. I know I can't do what I used to do because your heart rate increases. You may have a little chest discomfort, a little shortness of breath. I mean, you go up 2 to 3 flights and you can't do what you used to do. So you can't push it. I know I can't push it now. You see? There's a limit in what you can do according to what your cardiac status is.
That makes sense.
See?
So it's kind of like your own biofeedback, really.
Yeah. But you've got to be active. And it's hard to do when your ambulation decreases. You see?
So, but you get up in the morning for a regular day.
Every
You
day,
fix your
6:30.
breakfast.
No, I go to the hospital. I go to the doctor's dining room
Oh,
every morning and at noon.
good deal.
It's good food.
See, they cater to the doctors. In other words, there's competition among 3 hospitals. So this one hospital has a very good breakfast and noon meal for the doctors, which is next to the record room. That's one reason, one way they get the doctors to do their records. And they're right there, and it's easier for the doctor, or if they have to sign something, the record room will come in. We want you to sign this, or you're overdue 10 days on your records. So they're right there. And then they have monthly meetings where they feed them very well. I'm talking about big feeding, lobster, shrimp sent in, airplane. It's good when competition's always good. Doesn't matter if it's doctors or dentists or lawyers. Too much competition with the lawyers, but competition, when doctors came in, there were availability is much better. Not on house calls, but they are available more than
Yeah,
before.
but you're very slender, so whatever they're serving must be healthy, meaning low fat.
Oh yeah. No drinking, no alcohol, probably 2 beers a year when I'm real thirsty in summer. No smoking. And my weight has always been low. When I was an intern, it was 140. I thought I'd never reach to be 150. It's 160 now, which I won't let it go about that. Well, so weight is a big factor. Smoking and alcohol is a no-no. And plenty of exercise, but minimal now. I mean, that's a difficulty. I can go for a long time if I get more exercise, but I can't do it. See?
So when you say activity, it's like walking to the hospital, walking back to your car, making rounds, walking through the nursing
Going
home.
up the steps, no
Up the
elevator,
stairs, elevator.
and you really have to have good brisk walking, but it's hard to do because my left leg is weak from disc surgery. I can't help it. It's a physical nature. So
Yeah, I
you
understand.
have to accept it, you see, even though you don't want to. And also, plenty of sleep. I mean, nowadays I usually take about an hour in the afternoon, and then do activity or go someplace.
My father always did that. Everything stopped and he would have a 2-hour nap in the afternoon.
It's very common as people get older, then they get more drowsy.
Do you read at night?
Yeah, but I have mostly tapes, and I read quite a bit. I have medical journals always come in. You always have 3 or 4 medical journals, and you only read articles pertaining to your specialty. So I'd only take internal medicine. You get the journals, AMA, your specialty, chest diseases and heart, and what I don't have is a current medical books, but we have a big library. Anything you want, you can
At the
get
hospital.
right away. You can get anything, or I can write the medical society. I get all the current literature within 2 days. Call them on phone. So you really don't need to worry about a large library, but they're very good in giving you current literature within 2 days. And it's gotten so that the big centers want to get doctors involved. They want the cases. So Scott and White is a big hospital with about 150 doctors. Texas, they have their special service. You can call them for anything you want, any case, any doctor's on call to give you advice. Same thing with Houston, San Antonio. You
And
see,
you still do that
on problem cases.
at the nursing home?
But I don't have so much now because there's not many problem cases in a nursing home anymore. I do have it sometimes with the help at the hospital, but that's minimal. I don't have the real problem cases. You don't have any problem cases in geriatric care because everything's usually cut and dry. You see, unless the family is so involved, because your hands are pretty well tied in the elderly, how much you can do and how much you want to do, and the expense.
Is that frustrating to you?
No, people expect too much. That's a frustration. Family comes in, it's not so much the patient, it's a family. Demands are very great nowadays. You can have a patient with no resusc and the family comes in, I want this, I want that. And they show their superiority or their know-how, and they tell the doctor what to do. I want this, I want that. And legally, a doctor's in trouble. I mean, when the family wants this and wants that, you don't argue with them. You see?
Yeah, the last
They,
word.
the problem is there's too much knowledge being disseminated medically, but not the right kind of knowledge. And the people aren't well versed in what could be done and what should be done. And they show their importance, so come in. This is our biggest problem as a family, not so much a patient. And they turn to doctors. Any criticism or if you argue with them, they'll get another doctor right away. This second opinion is getting to be a very big problem, even in the elderly. You see? Some people want, for instance, a CAT scan of the brain, a person age 90. You know you're not going to do anything, but you're not going to do 2 or 3 CAT scans to make another diagnosis. You're not going to do anything if you do find something. You see?
You couldn't operate anyway.
That's a
No,
good point.
but this is the family. Now, we've had a lot of people that want to go on full resus, meaning tube feeding, intravenous's, and their vegetables. They may linger on a year, completely incompetent. And they're sorry they've done it, but a lot of people expect full code. In other words, everything to be done. So we have elderly people that have even no code. I want them in the hospital, so you send them in the hospital. They don't want to die in a nursing home for some reason. They want to go in the hospital. And nothing more will be done in the hospital and nursing home. But it doesn't cost them anything. Majority of patients in nursing home are Medicaid. They can't afford over the years. We've had them in 5, 7 years. So if we can afford that over the years, it takes, they run out of their money, then they go on to Medicaid. The state pays for their per diem, you see, and they get just as good care. But if it doesn't cost them anything, they want just as much or more than anybody else. You see?
I think I'm learning a little bit here.
And you don't argue with the family. I mean, the family, your legal situation is real bad. The malpractice situation is bad. People are very critical. And they won't consider anything except just everything just be perfect. It can't be perfect. You see? There's no way it can, because they expect, for instance, my own wife, she expects a pill for everything. Every little situation, a pill could cure. And if one pill couldn't cure, another person's pill could cure her. You see, the quackery is real great among the people. It doesn't matter what a doctor will say. Let a friend say, this, I've had something just like you, and this helped me, or this doctor helped me. You go to him. So, consider the friend's, response months better than yours on the QT. That happens often. I mean, it doesn't matter. They'll pay more attention sometimes because the person will convince them
They're looking for
that this is absolutely, I had the same thing and this pill cured me. Or another big problem is these LVNs that come around, they wonders, and they'll go to see a patient sometime or a friend they'll say, "You mean to tell me the doctor hasn't given you this new pill?" And that happens often. They show their importance. And then the doctor has to explain to the person why you didn't get this medicine. But this person isn't adept and doesn't know, and she takes a few little pills that she read about and shows her importance. Big nurse, big time, you see. And the quackery is real great in the practice of medicine. Everybody does it.
Yeah.
The vitamins a big
Vitamins,
factor,
herbs.
and the herbs is another coming thing.
Do you take any
Another
medication?
homeopathic medicine is another thing coming on. I mean, you know, and you can't blame the people too much because they want something done. They want a cure. If they hear something is available, they'll try it, especially in cancer. Cancer quacks #1.
Mexico.
Yeah.
Do you take any medication?
No, I don't believe in drugs. Nothing. I take a multivitamin 1 a day and a fluid pill because I have retention of fluid, that's all.
Very good.
But you
Never.
you don't take anything for your back then? You said?
No, nothing. Very seldom. I'll take a couple of Tylenol for a little stiffness. I take nothing for my back. I have a very high tolerance. I can stand pain. I can take a Benadryl and I can go to sleep. So I got a high tolerance. I don't need drugs. See? So, gosh, I haven't had hardly anything. Oh,
Well, you got too much going. You have too much to think about to take drugs. I mean, you're here on a medical meeting for continuing ed and going somewhere from here, aren't you? Where are you going from here?
well, no. The problem is if you're still in practice, it's hard to get coverage. Nobody wants to take coverage if they can't benefit from their cases.
Well, he went to Oakland.
So I have to pay to have coverage in my cases. You can't abandon your patients, see? So I get a bunch of calls, so this fellow, I'll pay him to take my calls. And they're reluctant to take the calls, they're busy enough the way it is, you see? You don't have backup, so it's hard for me to get around to do much. Either give up practice, but then what do I do just to travel? I'd rather just do what I'm doing, you see?
So I'm confused. You went somewhere last weekend and then came here,
No,
or I thought he was going to San Diego to visit somebody.
no,
You went to San Jose about a month ago.
He went to San Jose.
I went to.
And he's going to
California
Nashville
twice.
next month.
Oh, you're going to Nashville.
I have a son at Knoxville, one of the twins at Knoxville.
Knoxville?
Knoxville, Tennessee.
Tennessee. He works for a hospital.
He runs the, I don't know what you call it. He was running the alumni fund at A&M and San Diego University. Now he's running the fund in a large group of hospitals in Knoxville, Tennessee.
Is
So,
this
so he,
Glenn.
Glenn,
Steve.
he handles the financial endowments and things. It's a
So
big
how
job.
long will you be in Knoxville?
Will I be?
How long will you be in Knoxville?
Oh, see, I can't get away more than a couple of days.
Oh.
People take your calls or anything, so usually I'll go maybe Friday, Saturday, and Sunday. My son in LA, he's too busy,
Right.
so Raymond,
And I'm too
Can't
broke.
say-
You can't
yeah.
come up here.
so it's really difficult to get away. I'd rather do that than stop completely and I'd have nothing to do. You see? What would I do if I went to my medical work? You see,
That's a good
you
question.
see,
It's like
otherwise I'd
Gigi
be,
just.
What's Gigi gonna do? now
I'd
that
be
she's
dormant, I'd sleep
retired?
all
She's gonna
day,
get dormant.
and their whole lifestyle changes. You can't do that.
They go into nursing home, they don't have anything to do.
You've gotta get up, get dressed, and go.
Have a schedule, a routine. That's why the hospital's good. He's there every morning. He's gotta get there by 8 to eat, or you don't eat.
Go by
8:30.
8:30, and the food's free. You know, after that you have to pay, so that's an incentive to get there.
So it's,
What do you do that dinner?
they have doctor's dining room, I go there, but my weight increases, I don't go for meal. You see? You can get very heavy if you just take 2 big meals. I mean, they feed you too well. If I do go, I'll just take a salad or something. I watch my weight, 160, a star, you see?
Look, I'm catching on here. Gigi, we can take lessons.
Trick is build schedules.
That's a lot of discipline.
Well, it's habit. You see, if you've done it for years, you'll continue doing it. It's habit, otherwise there'd be no life. I mean,
Plus he's got a
it's
big house,
a routine, and,
big house to take care of, plants,
oh, I don't take care of it.
plant room, but you do a lot of watering and everything. It's a lot of
That's
responsibility.
not,
So are you saying that if all of my life I've eaten chocolate pie and lemon pie, that I'm probably gonna eat lemon pie and
Yeah,
chocolate pie?
that's right.
But I may take
you're
pie.
not gonna change unless something happens.
Physically.
Unless you have a heart attack, unless you have a stroke, that'll really be traumatic to you, and you'll change in a hurry. That'll happen very often. You have people, you tell them for years to stop smoking, well, you'll be in a nursing home, you're gonna die. That happens 100 times, and the patients tell me, I remember you telling me to stop this, to do that. You see them in the nursing home years, emphysema, critically ill, and they remember what they've been told. But you can't convince them. You can if they have a heart attack, death is imminent. And that'll really make them.
But where do you go when you have a physical? Does anybody tell you that you need to be doing something
Well,
differently?
I get a profile, which is all your profile blood count in the urine every year. I don't have a chest x-ray. I have a heart reading maybe once every year or two if I have symptoms. But you really, they say that any doctor treats himself as a fool. But if I'm in good health and take the profile and heart reading, chest x-ray every year, you don't have any symptoms, I don't. I'm not gonna get a stomach x-ray, a colon x-ray every year. It's been shown it's hard to pick up an early lesion unless you have symptoms. Then it may be too late. But to get a colon x-ray every year, every 6 months, try to pick up something, it's been shown it's not a valuable tool.
Plus too much
You
extra.
see? Too much x-ray, and besides, it's very hard to pick up, or to get a sigmoidoscopy, a colon x-ray, and get all these tests. It's been shown that regular physical examinations in the younger group will pick up very little, less than half of 1%. I did a lot of physicals for the General Telephone Company when they're in San Angelo, the executives picked up very little. And we did everything that they complained about, you see? It's been shown, unless you have some symptoms, that something can be done.
So if you were to go to Cooper Clinic, you know, do the treadmill thing, what do you think Dr. Cooper would tell you?
To walk more, to do more exercise, but I know my limitations. You know, you can't, age 87, you can't do what you're supposed to do. You see? You can do yourself a lot of harm. I don't have to go to Cooper's clinic. He can't tell me anything because I know my limitations. I know how much shortness of breath I have, how much heart racing, and going up 2 or 3 flights of stairs. I know my limitations, and it doesn't matter what he tells me, I'm not going to do it because
You won't exceed that.
I can't do that. You see, at my age, I'm really limited now. Your heart may be in it, but you can't do it. You see.
But I guess what I'm wondering is when I found out I didn't have a disc, I had a neurosurgeon that was supposed to be top neurosurgeon
Top
said,
man.
don't you dare go skiing,
Don't what?
go snow skiing, okay?
Mm-hmm.
I cried all the way back to Denton
Because that's what you wanted.
because I wanted to go skiing. Y'all know that.
Mm.
Of course, that's very traumatic on your lower back.
Well, let me tell you, I went to another doctor who is now at UCLA, and he said, what you need is to go to physical therapy and strengthen all those muscles
That's right.
and do what you're capable of doing.
That's right. You're in
I
the same
snow
boat that I was. That's right.
I snow ski.
Yeah. You got to wear a good brace, though.
I do.
You got to wear a good brace, and there's just so much you can do. You can't do what you used to do. You see? So
Do I?
you're just not going to do a lot of twisting and bending like you used to do. You
No.
straight going or a little twisting.
That's right.
You're not going to. So you're in the same boat that I am. You know what you can do, and you're going to do it. You see? I'd do more if I could.
So
You would do more too if you could.
that's how we all have to adapt.
That's
I mean,
right, yeah.
we still,
Your limitations are there.
like all of your children, Ronnie, I mean, we still do what we want to do, but we have to adapt. We have to do it a little bit differently, but keep going.
That's right, yes. Doesn't matter. You can't do what you've done 20 years ago.
Mm.
I don't know if you changed.
You see?
No, I can still do it physically, but it depends on my blood sugar. If I'm dizzy or not, I can't get out. I can't go as far. I got to carry some liquid with me. You know, but
It's not always activity physically.
your back hurts.
You
a
need
lot.
mental activity. That's the reason I go to the hospital. Confer with the doctors, or they talk about cases. Go to the meetings
Keeps it
and
interesting.
keep you interested. Keep up with the journals and you read them.
Do you
And
write?
the problem is, if you retire or semi-retire, the detail men don't come see you anymore. They snuff you off. So I don't have any availability of the newer drugs. So when I'm at the plasma place,
He just about figured out every angle here. This is interesting.
Yeah.
He's got
so
all
I got
bases
my
covered.
PDR, I have it, and I have to look up all the new drugs. But I don't get it's not always in print for another year. And a lot of these patients that come in the plasma place, you survey these cases, you can only take certain cases that are adaptable for plasma. You check on their drugs, and you have to know the composition of the drugs and see if there's any correlation or if they're able to with this drug and the sedatives or their illness. You see? There's a lot of new drugs coming in on the market every day. That's a pharmaceutical company. Always something a little better and more expensive. So I semi-retired in '88, sold my practice. As soon as you do that, no more detail, man. All your literature decreased unless you ask for it. American Medical, right away they know you're retired, semi-retired. So you order the journals and what you want and what you have to have, see?
But do you still see the detail in them?
No, they don't come to see you. You're,
Even though
you're semi-retired. There's no benefit for them to see me because I'm not gonna use much of their drug. They want someone that has big volume, and they're not gonna spend their time, or the company's not gonna let them spend their time. They're supposed to see maybe 6 or 7 doctors a day. They're not gonna spend their time with someone that's not gonna give them any, you know. It's a way of life. That's what
Yeah,
it
well,
is.
it's marketing, that's that simple.
That's
You know,
what-
what I was really wondering about, when you're 87, obviously, a lot of your colleagues are not with you anymore.
No, that's right. And they, of course, I go to all the medical meetings, and but you see that the phraseology in talking is about cases, and I don't have any hospital cases. It's hard if you're retired to go into hospital practice, see them day and night. That's why you cut down. You just can't do it after a while, you see, although you want to. So most doctors that get older, they quit altogether, but I haven't. I just
But
do
your
as much as I can.
friendships have changed with your
That's
colleagues.
right. Yeah, there's more communication among the groups than with me. You know,
Do you
I
miss,
refer cases to some of them, but not as much as I used to. So there's no advantage for them to cater to me like they did before. You see,
do you miss that?
because you could really, well, you know how many cases I'd send to orthopedic, a bone man, or GU man. When you have a large practice, they really cater to you, Christmas gifts and things, and this is their bread and butter. Boy, they really get wealthy on that. So they're the ones that make the money on the surgery and the referrals.
Do you miss that?
Oh no, it's I miss the follow-up on patients. I see a lot of patients at grocery stores. They always tell me what happened. They want to see me again. I'm sorry I left and everything, because over the years, when you build up a practice, you get very close to patients. When you're, number one is availability in the practice of medicine. If you're available and you're honest, boy, that'll really help you. I told that to doctors many times. Availability. Don't play golf on Wednesday afternoon and Sunday afternoon and Saturday afternoon and not be available. And that's where the problem is in most of the doctors. You see. But now with the HMO, they're not going to have to worry about that. They're going to get their patients. They don't have to work as hard. The patients will come to them. They may not get as much, but they'll be getting their patients. You see.
But to you, I mean, in that era of time when you practiced, it is what you really said, that you've got to be that it's kind of all or nothing.
That's
You have
right.
to be totally involved,
That's right. You do it or you don't do it. That's right.
and there's no in between.
You can't play golf. You can't be gone for 3 or 4 hours. In those days, you didn't have a beeper. You want some exercise, you go bowling where they get you on the telephone. That's about the only exercise I got for a long time, is to go bowling. And then they'd call you, and then you have to give that up sometime because you have to be sure they get you on the team. You can't miss, you see.
But you
So,
wouldn't have changed the office
it's-
for anything.
No, It's been satisfactory. I worked hard, accomplished a lot, but it was fruitful, all right. You have to have your health, that's number one. And perseverance and have some goals, you know. You have to, if you're lucky enough and have your health, I think that's number one. And it's, you accomplish a lot, you have a lot of friends, I know everybody in town practically. I can go anywhere I want, they all know the doc, I don't know their names, but they know it's a doctor, you see?
Yeah, that means
You
a
had it
lot.
all the time. So that's,
That
Means a
that's,
lot.
you're grateful that the people miss you, they know you, and you took care of them for years, and they give you an update. You know their face, it's hard to remember the names, but it's always, they know the doc, you see? So it's, that's one good thing about a small town. Everybody knows you, and you make it or you don't make it, you see?
I think that's gonna go sleepy here.
Yeah, I'm gonna start wrapping it up. It's
Yeah.
quarter
Oh,
after
just-
10.
Okay,
Just
is that
turn.
thing still on?
You got everything you needed, you think, or anything else you need to ask? You think?
Your leg?
What's wrong? What's wrong?
She
I got so interested.
She got
It totally
spasm.
fell asleep.
She's got spasm.
What causes a spasm? Like,
Oh,
why
no,
would
she was on that side.
No, I
it's a
just,
bad leg?
Sitting on that,
Oh.
their leg on
That's quite a Panasonic, isn't it? That's quite a setup, you know?
Detail, yeah, it's a big camera.
Turn it off,
Yeah.
man. It does too.
Spent a lot of money on it. She's scanning the room to see what the area's like.
The other aging area.
Waiting for her foot to come back alive here.